I'm joined today by Amber Joy White Feather. She is my book club leader, and actually we're studying a book called The Power of Now, and she is also a student at Lesley University studying expressive art therapy, and she is currently in an internship at the Common Street Spiritual Center. Amber, thank you for joining us.
Thank you for having me. I'm so happy to be here.
I'm so happy to have you, and I think it's very cool what you're doing because you are looking at how therapy can be informed by ancient practice and psychology put together, and you're writing about it. And I know from the book club, we're studying a book called The Power of Now, and you talk to us about, or at least you're trying to get us to learn and read about how we can be more in the moment. So Amber, what inspires you most to study holistic psychology?
I feel like the journey began on a personal level. Yeah, it was my own personal exploration with meditation. It came to me from a community college professor. I went to Massasoit. That's where my academic career began. And I was in a U.S. History 2 class. And just in passing, the professor mentioned, oh, I meditate, I practice Buddhism. And I was like, oh, what is this? I was intrigued. Let me learn more about it. So that began my journey. I was really connected with the Four Noble Truths and how to kind of get out of suffering. It was a challenging time period, but through practicing meditation and studying Buddhism, I did find that I navigated my way out of suffering. And I was like, there's really something to this. So when it came time to transfer, I discovered that Lesley had a holistic psychology program, and that program is very mindfulness based. So I was able to study mindfulness and mental health, which is where the book comes in, holistic psychology, yoga philosophy, yoga theory and practice, and everything that I learned, I applied to my own life, and I saw how powerful a transformation can happen through those practices.
It was your own transformation.
Yes. And then I was like, wow, there's something to this. So it was my own transformation, and I feel like my own personal transformation and my academic career are very much intertwined.
In some ways, when you treat the patient, you can speak from your own personal experience. It's like that idiom, physician heal thyself. You are speaking authentically.
Yeah.
That's very beautiful. Do you ever find yourself consulting with people who you can talk about your personal story with?
I've kind of left myself out of conversations, but I do find that I am sharing my personal story a little bit more now these days.
That's great.
Yeah,
and I think it's really nice for the people that you're working with and that you plan to work with. And I take it that probably inspires your interest in writing.
Yes. I've been reflecting on how it's all connected and how one step of the journey led to the next, and it feels like it's coming to a point where it's all coming together in a really beautiful way.
Yeah, that's really nice. And actually, I think it also informs the authenticity of your practice. Now, when you joined the Common Street Spiritual Center, did you start out saying, I'm going to be teaching a book club on the power of now, or was that something that...
No. I was like, I need an internship. This seems like a pretty cool place. Let's see if we can make that happen. Yeah, I had an idea of what I wanted to do and how I wanted to be involved in the community and what I wanted to offer, but I didn't exactly know that the Power of Now book club would be on the agenda.
Well, why did you pick that book?
It ties into my academic journey. In my holistic psychology class, my professor, he had us read The Power of Now, just a few chapters in that book to really understand presence and the power of being present. So it was a really impactful book for me to read at that time in my life, and I wanted to offer that to the community. And a big part of what I've really enjoyed about going to Lesley University is the discussion around the books. So I was like, well, let me see about facilitating something of my own. Now I don't have a doctorate. I'm not a college professor, but I had confidence in my ability to hold space for people to explore the content.
Yeah, it's a beautiful book club actually that you're running.
Thank
You actually bring us together. You have activities for us, and then we sit there and discuss really, I don't know what the word is, but it's really, really out there kind of topics.
Yes.
How the universe is expansive, and expansive goes within us as well, and how atoms are spaced out just like the universe and planets are spaced out. I tell you, that's really powerful.
Thank you.
And what kind of patients do you normally focus on in your expressive arts practice?
So I'm not fully practicing as a therapist right now. A lot of my research has been focused on healing trauma. So I feel like that's probably the direction that I'm going in as far as my career goes, helping people recover from trauma. And part of that, I'm sure, will be recovering from addiction as well.
Yes.
Yeah, so we'll get there.
Yeah.
Yeah, but as of right now, I've been a community support and facilitating these groups to, I feel we're on a personal development journey at this point.
Absolutely.
Yeah.
What do you think is the cause of trauma from maybe a holistic psychological perspective? Is it the lack of perspective in the power of now, like presence, or perhaps is it an energy that's taken or left in someone, or is it a psychological circuit problem of the brain where there's too much or too little of some transmitter? What do you think?
Honestly, I feel like it's a little bit of everything, and it depends on the individual, and it depends on the situation that was traumatic. And I think a big part of what determines whether or not someone heals from a traumatic experience depends upon whether or not they're heard or seen and listened to and validated in their experience. There's this idea, phrase, saying, I don't know, of blaming the victim. So something happens to someone, and say they do come forward and they do seek support, and maybe whoever they talk to doesn't believe them. And that, I feel, is very damaging on many levels. And I think that perpetuates the cycle of trauma. And I think that's the difference between healing short term versus carrying the trauma long term. But definitely the nervous system plays a role, and because the nervous system is hijacked when you do experience trauma that isn't healed in a short period of time, that it takes you out of the present moment, and you're no longer in control of your nervous system. So you have these reactions, and you're like leaving your body. In shamanism, there's a practice called soul retrieval, and that's my understanding of it. I don't want to claim to be an expert, though it is my own culture.
You have a native, an indigenous background, correct?
Yes, I do. My family's Micmac. We come from Listigouche, Quebec. Yes, but I am kind of displaced in a sense because I grew up in Massachusetts away from my culture.
Yes.
So that's why I don't want to claim ownership or claim to be an expert.
Yes.
In this topic, but I have read about soul retrieval, and my understanding is that when there is a traumatic experience, the soul will leave the body because it's not safe, and then the body's just kind of on autopilot, right? So the process of soul retrieval is bringing the spirit back into the body, and I think that that's very similar to what we talk about in our book club regarding the pain body. How when we have a painful experience, we may lash out at other people. It may present itself in so many different ways. But when we come back into the present moment, we come back into our bodies, we experience reality in a different way.
How does shamanism, retrieving one's soul, relate to going back into your body? You go back into your body, but your soul is not complete?
I do not know the answer to the question,
That's interesting.
to be honest.
I don't know. I sit in that book club with you, and then we explore all these arcane
Yes.
way out there. So, hey, the questions are going to be...
Yeah, I think that's a
Just
great
as out there.
question. I think it's a great question. And maybe we could even circle back to it sometime.
Yeah, I would be interested to know, because in the book club we talk a lot about how you take yourself out of the pain body, which is kind of the outside sensorium type of existence, and then we go into ourselves. And in the book they talk about philosophers trying to go into the out-of-body experience, but actually to become more present you have to go more into your body. And in shamanism, they talk about how the soul can be, you can have missing aspects of it because in this lifetime or in a previous lifetime, a piece of your soul could have been removed as a result of some experience that happened. And it may be with someone else, or it may, and the idea of shamanistic healing is to restore that wholeness to you.
I appreciate that perspective. I'm making a connection between that practice and holistic psychology, actually, because a big focus of holistic psychology is returning to wholeness.
Yes, that's very fascinating. And perhaps that is something that also translates into the psychological realm, because they say that when they look at neurotransmitters and the balances of the brain, basically they're kind of saying the same thing, saying that, oh, well, there's an imbalance of chemicals, but really speaking, there's an imbalance of your very existence, perhaps. And maybe the chemicals are just a reflection of that.
Yeah, there's so many, so many angles and so many perspectives, and I feel like they're all valid.
Yeah, it's really interesting. And it's so cool that it's your own heritage that we can draw from.
Yeah.
Do you think that when you practice expressive arts, or you're learning as well, could you give us an insight as to how it really works? Is it the expression that we kind of resonate with and makes people feel heard?
Yeah, I feel like sometimes when we go through things that are difficult to talk about, or go through things and we don't feel seen or heard, the emotions get stored in the body. They get stuck, and we can get stuck in many different ways. But through creative expression, that's another way in. So it's a different approach too. It's kind of like taking a back door. Say there's like a traumatic experience that is really difficult to talk about. You don't have the language to really express it, or talking about it would re-traumatize you. The expressive arts offers ways to access what happened, and ways to share the experience, give voice to the experience without it being a direct path forward. So it's, for example, metaphor. You could use metaphor to describe what happened without actually having to say it. And in doing that, you're releasing. There's an energetic and emotional release that happens through the creative process, without having to cognitively relive the experience.
Oh, really? Because you harmonize with the expression.
Yeah.
Oh, that's so cool. Are you able to maybe give us a sample of some of the expressive therapy and how it sounds?
Brief one?
Brief meditation? Sure.
And then we can do like a little writing activity?
Okay, let's give it a try. A brief meditation and a writing activity.
Yes.
All right, Amber, take it away.
So, if you will, find yourself in a comfortably seated position, feet flat on the floor for grounding, palms up to receive, and begin focusing on your breath, tuning into the internal sensations within your body, Feel your body supported in the chair beneath you. Feel the spaciousness that surrounds you. Observing the content of your mind without judgment. Bringing your awareness to any emotions that arise. Just observing without judgment, maintaining open curiosity to your present moment experience. How does it feel to be present in your body? Do any images come to mind?
That's a guided meditation.
Yes. In the past, part of the practice that I've done has been more in terms of guided imagery.
Okay.
Yeah, where we go up into the, that place, that the place of no mind.
Okay. You'll have to educate me a little bit.
We journey into the void, so to speak, but into the, what I think Carl Jung would call the imaginal realm.
Okay.
Yeah.
So you paint an image for people to find themselves in a space.
Yeah.
Reflective of that image.
Exactly. It usually involves walking through a door and there's a pathway that leads somewhere, probably to a clearing, and then there's maybe a spirit guide or a different part of self. It could be your shadow self. It could be your higher self. And then you just interact there in that space, and sound healing's usually involved. And then when we bring you back from the meditative journey, then there's some form of creative expression.
Yes.
Whether it's drawing or writing. I usually try to keep it open and give different options, because different people like different things and they had different kinds of experiences and may want to express themselves in different ways. So I like to leave that open to the individual.
It's fascinating. What is the most, I would say, odd expression that you've ever come across in doing these with people?
Odd expression. Well, I don't know if I would call them odd. I would say that they're all unique.
Unique. That's what I meant.
Yeah.
The unique expression. What was the most unique quote?
Unique expression. I'll speak to one of my experiences. When I was in my yoga psychology class at Lesley University, we took a journey to meet a spirit animal. Oh. And mine was a bear. Yeah. And it handed me an apple and said, "Don't eat it." Yeah. And I bring it up because this one has been coming to mind quite a bit. And I'm like, well, what does it mean? A bear handing me an apple and saying, "Don't eat it." Right? The tree of knowledge comes to mind.
Okay.
So I don't know what the bear meant.
Yeah.
But I would say that was kind of an odd experience.
Yeah.
One that I still reflect on.
Yeah.
But it's always different too. And one thing I noticed is that, so say we're doing like shadow work and we go meet our shadow self. And the shadow may take one form one time. And then if you go back weeks, months later, the shadow will take a different form another time. So that's something interesting that I've observed.
What is the shadow form for those of us who are uninitiated?
Yeah, so in the psyche, at least from my understanding, I can only speak from my understanding, Carl Jung refers to the shadow as the rejected parts of self, like the parts of us that we don't want anyone to see or that are deemed socially unacceptable, and the repressed parts of self. Oh. It could...
I'll have to... I'm reversed. See, I got to get the normal self out. See that? No. Everywhere I go, that's the reason. Darn it, it's Inside Out.
It's a good movie.
Yes.
It's very insightful. Yeah, the shadow can act out similar to the pain body. Yeah.
How so?
It can, when we behave from an unconscious place, we're not conscious of it, we're not aware. Say it's an interpersonal dynamic. The shadow can sometimes tint our perception in a way that may not necessarily be accurate. We could be perceiving a present situation through a past lens, so to speak. So in that way, it's similar to the pain body. And the shadow can be quite reactive sometimes, and in not perceiving the present situation accurately, the behaviors that correspond with that could be problematic. I don't know if that answers the question or not.
Understood. It's a lot like the pain body, where it's clouds your perspective and causes you to be more reactive than you otherwise would be if you had the right perspective. Similar to the pain body, where you think that the pain body is you and you're experiencing all this pain, but actually it's not you. It's just a sensorium. It's an illusion.
Yes.
It's very, very cool. You know, you combine that with traditional psychology, and then you have this holistic, ancient, informed foundation. And even psychology for itself, for all of its criticisms, mainly come probably from the fact that it's not fully integrated with a lot of wisdom that has stood the test of time. And I think a lot of people, they tend to question a lot of the conclusions simply because the whole story isn't there.
Yes, that's a really good point. The way that I look at it, or I've come to view it, is each theorist brings a piece to the puzzle. There's relevance, I find, in all the theories. I know Freud receives a lot of criticism, but even in his perspective of things, and then the behaviorists built off of that work. And I think the beauty of holistic psychology is that it brings it all together. It brings the pieces together in a way that creates a fuller picture. And it does allow for integration. And integration is a big part of holistic psychology.
Yes. Where do you find the intersection comes with medication management? Can that actually further push you into the pain body or the shadow self, or mess up your ability to find your wholeness? Or is it just another external thing, like, the sensorium outside, and doesn't stop you from really finding yourself?
That's a really good question. I don't know too much about medication. I do think that it helps people manage symptoms so they can receive treatment, but treating the symptoms doesn't necessarily treat the cause. And I, from what I know, a lot of medications have a lot of really intense side effects that impact people in ways that I couldn't even pretend to begin to understand. So I don't really know.
Yeah. Well, we talked about in the book club about how reactions, sometimes your fight or flight mechanism and your body's reactions could simply be a physical or like a hormonal or a kind of a brain-mediated response, and not necessarily our true self. And similarly, a medication is simply just mimicking normal processes in the body by pretending to, trigger something or another, a receptor to try to mimic something the body would be doing naturally. And I wonder if that plays into the concept of the pain body, because essentially you are tweaking the external sensorium. But in some ways, when people say they feel better on medication, are they simply feeling better in the external pain body or in the shadow self? And maybe they haven't delved into their experience of life internally.
That's a really good point. I feel like one of the things that holistic psychology offers is personal empowerment. When we talk about medication, the idea of the placebo effect comes to mind. But the mind is very powerful, and meditation, from what I've studied, helps rewire the brain. It helps create new connections so the old ones can fall away. So I do see what you mean about the medication mimicking the body's natural responses.
Yeah.
So I do feel that there are ways, there are practices that facilitate the healing that is needed.
Yeah.
And the body naturally heals itself.
Yeah.
Yeah.
Do you find from your own personal experience that you found natural healing?
Yes.
What was it like?
I would say commitment to my journey, and I wouldn't say that it was easy. It's a lot of falling down and getting back up, and commitment and persistence. But healing, it's a dedication to self and wanting better. At least that's from my experience. I wanted better for myself. I wanted to live better. I wanted to be better. I wanted to be a positive influence on the world. And so the way that I approached that was through healing myself and changing my behaviors. And I did that through meditation and yoga and hiking and finding community and expressing myself creatively. And it works, but it's a journey and it's a process. And I don't think, for most things in life, especially difficult things, I don't feel like there's a quick fix. And I think that the world around us, I will say, like the dominant society, is all about quick fixes. And when it comes to healing, it's a natural process that takes time to evolve and unfold.
Hmm. Do you find yourself towards the end of that or still at the beginning?
I feel like it comes in waves. The image of a spiral comes to mind, right? You heal one layer and then you're like, yeah, I'm good. But then you go a little bit deeper, or something will, say the shadow gets activated, the pain body gets activated, and you find yourself like reliving experiences that you thought, oh, I already healed from this, but it's like, no, there's just a deeper layer of healing that is happening. It's not all at once. It's gradual, and it sometimes takes peeling back one layer after one layer, and you think you're good, and then something happens, and then before you know it, you're fully activated again and out of your body, and then you have to go through it. But once you have the tools, it becomes a little easier each time that happens.
Wow, that's so beautifully said.
Oh, thank you.
Amber, I wish you full healing and good life,
Aww.
and I want to thank you so much for joining us.
Thank you so much for having me. I'm so happy to be here.